So, welcome you again, my doctor friends, and we are going to go for these notes, and this will be the seventh video of MCS entrance preparation. Let's continue. Ulnar nerve supplies flexor carpi ulnaris and the medial half of flexor digitorum profundis. In the hand, hypothenar muscle, interosseous muscle, thenar muscle. Okay, let me read it very clearly. Claw hand, lesion of ulnar nerve, clumps paralysis, a combined lesion of ulnar and median nerve. Area of sensory supply of median nerve, both the palmar and dorsal supply of radial 3.5 fingers. Hypothenar muscles, palmaris brevis, adductor digiti minimi, flexor digiti minimi, opponens digiti minimi. Or Duchenne paralysis, policeman's tip hand, Horner syndrome, enophthalmos myosis, pseudoptosis, anhidrosis, loss of cilio-spinal reflex, sciatic nerve palsy, complete loss of sensation below the knee. Staphylococcus aureus and streptococci, dual antibiotic cephalosporin and beta-lactam. For MRSA, tetracycline and sulfamethoxazole. Heel ulcer, dry eschar may be treated with offloading Durkheim disease or adipose dolorosa, painful, tender, diffuse, or nodular deposits of fat in trunk, limb, keloid proliferation of fibroblast, collagen fibrils, and immature blood vessels. Malignant melanoma, tumor thickness more than 4 mm suggests worst prognosis. Malignant melanoma, stage 1 more than 90%, stage 2 70%, stage 3 35%, stage 4 less than 2%. Melanoria occurs in case of hepatic metastasis. BCG has been used with some success. Melanin producing cells in the body, in skin, choroid of the eye, meninges, medulla, tela choroidea. Secondary varicose vein, inferior vena cava thrombosis, peripheral vascular disease, venous refilling, Harvey's sign, crossed leg test, Fuchs test, assessment of presence of popliteal pulse, Berger's disease, thromboangiitis obliterans, intermittent claudications has grade 1, 2, and 3. Muscle power, grade O. No muscle contraction, paralysis, grade 1. Only flicker contraction, no movement. Grade 2, can move, only when gravity is eliminated. Grade 3, can move against gravity but not against resistance. Grade 4, can move against some resistance. And grade 5, can move against normal resistance. Normal power. Duplex arterial scanning, ABPI index, ankle BP, brachial BP, appropriate antibiotic options for PVD, vancomycin plus piperacillin plus tazobactam. vancomycin plus metronidazole plus equinolone. In case of diabetic foot, aspirin and beta blocker contraindicated. Antibiotics, statins improve dyslipidemia. Anti-thyroid drug neomaracazole decreases hormone synthesis. Carcinoma thyroid, female is to male equals 3 is to 1. Papillary carcinoma, also called occult carcinoma. Papillary carcinoma 60 to 80%, follicular carcinoma 5 to 25%, medullary carcinoma 5 to 10%, anaplastic carcinoma 4 to 10%. C cells must secrete in MTC. Calcitonin, CA, histaminase, calcitonin, gene-related peptide, serotonin, chromogranin, substance P, somatostatin, VIP, prostaglandin, ACTS, TSS. Look for any cuff impulse at saphenous opening. That is called Morrissey's test. Recent advances in treatment of varicose veins, RFA and EVLA. Important complications of RFA, DVT, pulmonary embolism, superficial thrombophlebitis. RFA is better than EVLS with respect to pain, score, chymosis, and other complications. The structure to be preserved in radical mastectomy. Long thoracic nerve, thoracodorsal nerve, cephalic vein, and axillary vein. Hormone therapies for metastatic breast cancer. Premenopausal women, first line therapy, tamoxifen. Third line therapy, misostrol acetate. In postmenopausal women, first line, tamoxifen. Second line, anastrozole. Third line, progestin. 1. Thyroid graph sign. If lead lag is present, the sign is positive. Still wax sign. Infrequent blinking, stay alert. Mobius sign. Failure of convergence on accommodation at a near object from a distant object. The sign is positive. Lahey is a method of thyroid palpation from front in obese patients. Pizzol's method for palpation. Small swelling may be palpated by Crowell's method. Pemberton's sign is said to be positive if there is retrosternal prolongation of goiter. Post-operative mortality of Boage score is Boage score 0, 1, 2, 3. Post-operative mortality 1.5%, 14.4%, 32.1%, 100%. Indications of hemodialysis: blood urea nitrogen more than 80 m equivalent per liter, serum potassium more than 5.5 m equivalent per liter, persistent acidosis, acute volume overload. Uremic symptoms: avoid secondary renal insult by avoid nephrotoxic drugs, maintain intravascular volume. Adjustment of some drug doses depending on creatinine clearance. Role of biological therapy in gastric cancer. Cetuximab, epidermal growth factor receptor inhibitor. Trastuzumab, Herceptin, human epidermal growth factor receptor 2 inhibitor, SER2, Bevacizumab, monoclonal antibody of VEGFR family, combination of hepoaptin with 5-FU and cisplatin, cetuximab as monotherapy and combined with 5-FU. Boundaries of popliteal portion superomedially by semimembranous and semitendinous, superolaterally by tendon or biceps femoris, inferomedially by the medial head of gastrocnemius, inferolaterally by the tendon of plantaris and lateral head of gastrocnemius. Roof is formed by popliteal fissure pierced by a short saphenous vein as it terminates into popliteal vein. Corneas triad, functioning extraadrenal paragangliomas. Pulmonary chondromas exist. Structures they are removed in Whipple's operation. Whole of duodenum up to 10 cm of proximal jejunum, head and neck of pancreas including uncinate process distal 40 to 50% of stomach, lower end of CBD, gallbladder, pericholedochal, periduodenal, and peripancreatic lymph nodes. This page has a lot of blur pollution, and it's because of some water droplets, I guess. Systemic chemotherapy with combination of agents using cisplatin, methotrexate, adriamycin plus vinblastine, esclarosant, sodium tetradecyl 3%, ethanolamine oleate 3%. Acute biliary peritonitis, Walters syndrome. Important causes of aneurysm, atherosclerosis, traumatic vascular disease, syphilitic, mycotic due to bacteria, and but I can't read it very clear. Vessels affected by aneurysm is that what I can read is arc of aorta. That may be ascending arc of aorta or arc of aorta, okay? Descending thoracic aorta, abdominal aorta, carotid, subclavian, axillary, femoral, popliteal, cerebral, mesenteric, splenic, and renal arteries. To cure tonsillitis due to weather change, treatment reducive, azithromycin and vitamin tab lycopene. Bloom Richardson grading system. Tubal formation 75%, 1, 10 to 75%, 2, less than 10%, 3. Nuclear polymorphism, regular uniform, 1. Moderate pleomorphism, 2. Marked pleomorphism, 3. Mitotic count less than 10 by 10, SPF 1, 10 to 20, SPF 2, more than 20, SPF 3. Well differentiated low grade 3 to 5, moderately differentiated intermediate grade 6 to 7, poorly differentiated, high grade, 8 to 9. University of Texas, SSC scan, Antonio classification, 0, 1, 2, 3. No open lesion, 0. Superficial wound, 1. Tendon capsule, 2. Bone joint, 3. With infection, all same. Ischemic. Infection ischemia. Balzer grading and score in acute pancreatic CECT. Finding CT grade and score. Normal pancreas, CT grade A and score 0. Focal diffuse enlargement B and 1. Mild heterogeneity. Internal external pancreatic inflammatory changes C and 2. Prominent pancreatic inflammatory changes D, and over there is 3. Just go. Range 0 to 10. Multiple extra pancreatic fluid E or 4. Over there score is 4. Collection abscess necrosis 0, 33% 2. 50% 4, and more than 50% increases. CT severity index, Balzer score plus N plus necrosis. CT severity index equals Balzer score plus necrosis. Okay, we are going to go to the last page for this video. Bloom-Richardson grading system. Tubule formation more than 75%, 1, 10 to 7. Oh, I guess we have already learned it, right? Okay, so that will be revision, no problem. Tubule formation more than 75%, 1, 10 to 75%, 2. And less than 10% is 3. Nuclear pleomorphism, regular, uniform, 1. Moderate pleomorphism, 2. Marked pleomorphism, 3. Mitotic count less than 10 by 10 per SPF 1, 10 to 20. SPF 2 more than 20. SPF 3 well differentiated, low grade 3 to 5. Moderately differentiated, intermediate grade 6 to 7. Poorly differentiated, high grade 8 to 9. Ranula arises from noon and blandine. So strong operation is treatment for thyroglossal cyst. Brachial sinus, external opening seen at the anterior border of the lower third of sternocleidomastoid muscle on the right side. Okay, so all my doctor friends, have a good day for today. Study well, and we are going to be here with the next video ASAP. Have a good day.